One of the reasons that Norman Rockwell's work has endured is because he saw us as we were, but he also knew that it wasn't always going to be this way. And aren't we fortunate that we have his body of work? Take, for example, this wonderful rendering of the pharmacist. You know, in today's big pharmacies, there's not much use for a mortar and pestle. But you know, there are still pharmacies, they're called compounding pharmacies, where the mortar and pestle and doc are still working every single day. We're going to spend this next half of an hour in just such a place. It's called North Beach's Pharmacy, and it's right here in Jacksonville. Compounding pharmacies, are they a dying breed, or are they having a resurgence? What do you think?
I think they're having a resurgence, actually.
Why, Mike?
People are more interested in individualized doses for themselves and their pets. So I think, you know, it's coming down to the only place you can really get that is at a compounding pharmacy.
Not only do you treat human beings,
Right.
but you also have a major practice that deals with animals. Which would you like to talk about first? You want to talk about our four-legged friends first or our two-legged friends first? Which would you prefer?
Four-legged friends.
Yeah.
Why
Okay.
not?
I think so.
Let's dive in.
Okay.
Dr. Norman, do people bring their pets into the pharmacy?
They do.
They do?
Often, yes. They do.
So, for example, within the last week, what's been the run of the bill of fare, so to speak, of pets that you've seen?
The most common pets that we see are, you know, our furry canines and our furry felines. Those are the easiest to bring around. Recently, I've seen a cat that our owner brought in their cat because they're starting a new medication, a transdermal ear medication that delivers the medication through the membranes of the ear, so they don't have to take it by mouth or get an injection. And she wanted to know how to do it, so I put on some gloves, showed her how to put it on the cat's ear, and the cat had no idea. Just thought it was getting more attention.
So you have to, not only do you have to do the prescriptions, but you also have to show the owners how to minister to the pet.
Definitely.
Well, yeah.
We have to counsel the owners on, you know, side effects to look for, and same thing as if you're giving medications to people.
Do the veterinarians rely heavily on your advice as to what to do with their animal patients?
If they're having a problem with the dosing or, you know, the compliance, trying to get the client to give it to their pet.
Without a compounding pharmacy, that most of these pets would be in very serious trouble because they would not be able to get the medications properly prescribed. Is that an accurate statement?
It sure makes it easier. You know, you can give them a flavored treat that they like to eat, you know, and just give it to them like a treat, and they'll beg for the medicine is the key.
I had a rabbit one time with a head tilt, had an infection of the ear, and I think it's just before I knew Mike very well, but we were having a hard time really getting the medications on board, and so I had called over here and they put it in an orange flavored liquid, which the rabbit loved and took very readily and got better very quickly after he started to take his medicine. So it makes it much, much easier to medicate the finicky guys.
Do you think that without compounding pharmacies that the pets would be in trouble?
I do. I really do. For pets, it's pretty much 90% of the time weight-based, and so with that creates very individualized doses. So it's very hard. It would be difficult for them to use something commercially available, and so compounding, it offers many different varieties, and you know they're getting the right strength and the right medication, which is important.
A dog can be 180 pounds down to 2 pounds.
We use Mike's services a lot for a lot of the smaller pets that are hard to accurately dose with the pills that we have. And also if we have pets that are finicky and don't want to take a pill or are very hard to medicate, we'll have Mike make them into a flavored tablet or liquid to use, which makes it much easier to medicate the pets.
I assume that dosages are an issue both in terms of the breeds, the species, the size. What are some of the other variables?
In most cases, they need either a quarter of that tablet or even an eighth of that tablet. And if you sit down to cut a tablet in half, is one thing, but go to a quarter, very difficult.
Yeah.
It crushes it. You don't get it cut exactly in half.
What about if you had a little pet mouse or something like that? How would you?
We'd have to put it in a liquid, a very concentrated liquid where a very low volume would be given, and peanut butter flavor.
Or cheese flavor.
Cheese flavor too, yeah, I like it.
Oh.
I have a feline rescue in Ponte Vedra, Florida. Since 2003, we've rescued over 450 cats, and we find homes for them. And in doing so, we spay and neuter, and we prevent the births of millions of kittens. I have a doctor, a veterinarian in Ponte Vedra Beach, and I've had several cases of special needs with my kittens. Some of the kittens are very small and weight sensitive to medicine. And the typical medicine that would be prescribed by a veterinarian off the shelf is not appropriate for a less than 1 pound kitten, or a geriatric cat, or even a severely injured cat. And sometimes it's a matter of palatability. So Mike is able to formulate or compound the product so that the cats can be given the medication and be on their road to healing.
At North Beaches Pharmacy, our patients are people and pets.
The cats can be given the medication and be on their road to healing.
We're a compounding pharmacy, specializing in custom dosage prescriptions, not available at other pharmacies.
They're always available to talk to, and they're knowledgeable.
If you, your pet, or family member has a special need or requirement, ask your healthcare provider to fill your prescription only at North Beaches Pharmacy. North Beaches Pharmacy, where your health is our business.
You can drop by North Beaches, and here you will get your refrigerator magnet. Very important for you to have that. Plus these 2 very informative brochures. So come on by, say hello, and pick up your information package. We have been spending the first part of the program talking about the little 4-legged patients. And I just have one more question about that, and then I'd like to turn our attentions to the human patients, not the animal patients.
Right.
With the veterinarians that you work with, how heavily do they rely upon your input and information to help you with their diagnoses as well as prescribing the right amount of medication for each animal?
I think they rely on us a good bit. I think, most of the veterinarian, or almost all that we work with, are very knowledgeable in their practice, and so they know, they can, with the diagnosing part, they're pretty up to par on that. But what the problem where they consult with us is when they say, this pet has an infection, this is the only thing that can treat it. How do we get this medication that's very toxic? How do we get that into them? Or is there another alternative? Or can we do something else? And so that's when we go to the drawing board and just try and figure something out and work together to make it work.
So it's not only a science, Mike. It's an art as well, isn't it? You got to
Exactly
be
right.
You have to be innovative.
We have a lot of people who bring their tablets that they get at the vet, and we'll compound that into a liquid that their pet will take.
I see.
So they actually get the medicine from the vet and bring it to us to make it more palatable.
What percentage of the vets use a compounding pharmacy as opposed to the NIC pharmacies or dispensing from their own practices?
8 or 9 years ago, very few of them did, but over the years, they've become to realize that it's a
Makes their life easier.
It does. It really does, and it makes their life easier and makes their clients' life easier,
Yeah.
and they get better results with their patients too. So it works very well for them.
It's a win-win all around.
Yes, it
Yes.
is. Yeah.
Is it true, Dr. Norman, that basically little 4-legged animals or animals in general get the same problems that we have?
They
the same
do.
Health problems,
They
same
do.
health issues.
They do. And but the interesting side of that is that a lot of times the medications that we take as people can work differently in pets. Like an example is a medication called Piroxicam. It's just an anti-inflammatory. It's similar to like Motrin or Advil or something like that. But once I started compounding and talking to the veterinarians, they use it for tumor suppression. Bladder, especially in the bladder, they use it to suppress the tumor and
It's
from
very
growing.
effective.
And it's
Very effective.
extremely effective. And it's something that,
So maybe there's some good science
adds
there
years
to use
to their
with humans
pets.
as well.
Yeah. But it's in the people and humans, it doesn't work that way. It's
No,
more
it
of it works some other
Interesting.
different way in the pets to make that work. And so that's one of those examples where for pets it makes a big difference in cancer growth, cancer treatment. But for us it's just an anti-inflammatory, which works well for that as well, but it's not the same.
Right.
It's not synonymous between both.
And also, cats metabolize things differently than most other animals. So.
Do cats metabolize differently than dogs, and do dogs
Very much so.
metabolize differently than snakes and so on and
Yes.
so forth?
Dogs are very much like humans as far as their metabolism goes, but cats are, it's like aliens dropped them off, and they're mammals, and they flew off laughing. So the way they metabolize things are very different. So, like with aspirin, they don't metabolize aspirin at all. And even a small domestic cat or a tiger, you can only dose them like every 3 days. And so it's interesting, the differences.
Do the schools offer this kind of information, or is it basically you have to learn it on the job?
I think it's both. I think now the schools are kind of a wider scope of pharmacy. Pharmacy, the profession of pharmacy itself has changed so much over the last 20 years. It's in all aspects, in the the independent side and the community side, and also in the hospital side. So that has allowed pharmacists more variability in different ways to what they want to practice in. And the schools, they do offer classes like that. They do offer, if you want to learn more about veterinary medicine, usually they have a veterinary school on campus, and they can work with the veterinarians. So that's offered. Some of them do teach compounding, different states. The state Georgia, where I went to school at, they did offer to teach some compounding because it's required in order for you to get licensed. But I think in Mike's case, he actually went and had extra training and certification through outside sources of school.
Yeah, I enjoy the compounding part very much, and the additional training is necessary to really get the art part down, and then the practice, of course.
Right. But there's on-the-job training that goes along. I guess you're learning every day, aren't you?
We are.
Every day's a
We
different
are.
deal.
Yeah, you got to figure it out, just like a doctor diagnosing a particular problem for a patient.
Correct.
So interesting. So
And the great part is you get to work together with other medical professionals to help the patient get the best benefit.
Dr. Norman, do you think that there's a greater rapport between a doctor like yourself and Mike, for somebody like you who's a registered pharmacy, between you and the doctors who prescribe, knowing how you interact with them and knowing how you interact on behalf of their patients? Do you think they're appreciative of it?
I think so. Most of or almost all of the doctors and veterinarians or medical professionals that we work with are very appreciative of our services and enjoy calling and problem solving with us because, we enjoy that. They're really, we're all looking for the best solution for our patients.
So it's kind of consultative. It's like a troika of people concentrating on the patient.
Right. A patient has a team of people together solving the problem, which is a great thing. You can only serve them better.
It's a doctor, the pharmacist, and the patient.
Yes,
So it's a triad of healthcare.
Recently, there's been a campaign running on television, and in a way, Jacksonville is an appropriate place to bring this up, particularly in TPC season, as it is right now when we're filming this program. And I'm sure Mr. Els is there. And he has come forth and said that his child is autistic. And there's a terrible statistic about autism in children. 1 in 100 children is autistic.
That's
a lot of children.
And I know that you are deeply involved in helping with that particular problem, and I'd like you to tell us about that, if you would, Mike.
Well, autistic children, many of them have food allergies and things. They don't tolerate sugar, and most of the medications that are made for them are pediatric doses. They're liquids, and they contain sugar. So that's an opportunity to compound for them in a form that they need versus, what's commercially available.
Our youngest daughter has autism, and she has some pretty severe food allergies. And so he is able to make very simple things that most people take for granted. For example, ibuprofen. Most people can just go to their local drugstore and pick up a bottle of children's ibuprofen. Unfortunately, we don't have that option, but we do have Mike. And so he's able to make a safe version so that she can have that pain reliever when she needs it.
Dr. Norman, should we be ticked off at the manufacturers of those medications for putting that sugar in there?
It's like we were talking about with the pets, it's just a way of trying to get the kids to take medications. And for those other 99 kids that are not autistic, it's okay. It's a good way for them to flavor their medication and take their medication that they might need. But for these autistic children, they just need the medication without nothing else. Without anything, any dyes. They're allergic to dyes. A lot of times that triggers some of the problems of the disease and the symptoms, right? And so that's something where we can help out. Just medication and water, and or however we make it, capsule form. We make a bunch of different forms, injectable forms, where it's just the medication that they need, and it helps them a lot.
This is a very serious issue. To me, it would be anyway. Yeah, and I want to know and understand: is in the medical community, are they aware of the problem?
I believe they're much more aware of it now than they were even a couple of years ago. In this area, we're very lucky to have some. Dr. Julie Buckley is very well known and just wonderful, and she's thinks outside the box. You have to do that with these kids.
My name is Julie Buckley, and I'm a pediatrician who has sort of involuntarily ended up in the field of autism, which started for me when my daughter developed autism at the age of 4. And what I have learned about that is that it's not just a disease that is a psychiatric disease, as so many people think about it. It's actually a disease that involves tremendous gut problems and immune system problems and methylation chemistry problems, some very complex biochemical problems. And in working to heal my daughter and beginning to work with lots of other children around the world who need to be healed, we have had to be very creative in how we take care of them and in how we answer their needs. And that's where compounding pharmacy and working with Mike has been such a delightful pleasure. We've been able, I can call up and say, Mike, I need this. And I can get an answer for, well, if we did it like this, I could do it for you so that it turned out like that. Or if we did it like this, I can make it so it turned out like that. And I can get concentrations, I can get tastes, I can get flavors. And what's really of tremendous importance for me is that I can get medications that are pure medication with no fillers. I can get medications that are created without gluten and casein in them. I can get things that are made as capsules instead of as pills. I can get things without any added food dyes. And I can get things made for children who still need liquids in flavors or in non-flavors that are completely acceptable to the families and to the children. Many of my kids have tremendous problems with tolerating foods, sugars, food dyes, and other chemicals, so that many of the routinely made pharmaceuticals are things that are just not an option for my kids. And so we're very grateful to have somebody who's willing to be creative, local. He's a custom shop who, thank God, has completely understood the needs of my children and has been willing to work with them and to work with the families. One of the things that I think I remember most was a child who had a horrific fungal infection in his ear that had been present for years and years and years. And the typical things that would have helped weren't helping and weren't making things better. And finally I had an aha moment of, gosh, I wonder if I used a different antifungal, would it work better? And so I called Mike up and I said, okay, this is what I need and I don't think it exists. And he said, I can make that for you. And so the mama went over and got it, and it worked. And it has been such a godsend to us. We've used it on several other children in the ensuing years. So that's just been one of many situations.
Talk to me a little bit about the quality of life for the autistic child using the proper medication versus not using the proper medication.
Well, the quality of life for the child, you know, they have to take a lot of medications a lot of times. They just have to. It's just part of their treatment. But the quality of life for the parents, it's very difficult for them to keep on this regimen of medications and always be looking for what's in this food product or what's in this. And so we offer a relief for them that we can say, hey, this medication, we can make it. It's not going to have the harmful substances for your child, and it makes it
And
a little easier for them.
Do you see
They're very
an
happy.
immediate reaction, I mean a positive reaction, when they go off the medication that has the dyes and the sugars and the other contraindicated ingredients?
Yes, you do, yes. A lot of times, because of the sugar, they have problems with yeast. And in their bowels, they can have, diarrhea, that kind of problems with the other medications. And if we can eliminate that part of it, it helps.
And it makes those poor kids happier.
Gives them a better quality of life.
Gives them a better quality of life. Okay.
And, when you have a special needs child, they're unique, and including what goes in needs to be unique to fit their needs, and Mike makes sure that happens for us. We can't go to a typical store and a typical pharmacy and get any medication. It has to be specially compounded for her. They're a blessing to us. So I don't know what we'd do without them, and we're lucky to have them in this area.
At North Beaches Pharmacy, our patients are people and pets.
The cats can be given the medication and be on their road to healing.
We're a compounding pharmacy, specializing in custom dosage prescriptions not available at other pharmacies.
They're always available to talk to, and they're knowledgeable.
If you, your pet, or family member has a special need or requirement, ask your healthcare provider to fill your prescription only at North Beaches Pharmacy. North Beaches Pharmacy, where your health is our business.
Two questions I'd like to ask you. One is about nutraceuticals and their importance, how you feel about them. I'd like to get your opinion on nutraceuticals. And then also the generic versus the name brand drugs.
As far as the nutraceuticals, I believe that there is a place in therapy for that, for many people, that they're finding now with our diet, our lifestyle, that we are deficient in some of those nutrients. And so supplementing them alongside of our diet and being outside, and like vitamin D, for example, is helpful. But I think also that there is an overuse of that.
Do you find, though, Dr. Norman, also that there's a tendency on some people's part to substitute prescription drugs for nutraceuticals and vice versa?
Yeah, I do. A lot of times they'll read certain magazines that promote nutraceuticals, and they'll take that instead of their blood pressure medicine or arthritis medicine. And sometimes it works, sometimes it doesn't. But a lot of times the doctor is cut out of that, so it's dangerous in that way.
If you're going to be taking a nutraceutical, it needs to be, your doctor needs to be aware of it, your pharmacist needs to be aware of it. Exactly. So that way, because a lot of times they can interact with your prescriptions that you are taking, or if it's prescription or over the counter, it can react.
At North Beaches Pharmacy, our patients are people and pets.
The cats can be given the medication and be on their road to healing.
We're a compounding pharmacy, specializing in custom dosage prescriptions not available at other pharmacies.
They're always available to talk to, and they're knowledgeable.
If you, your pet, or family member has a special need or requirement, ask your healthcare provider to fill your prescription only at North Beaches Pharmacy. North Beaches Pharmacy, where your health is our business.
We have a medication that has a muscle relaxant in it, as well as an anti-inflammatory agent in it, and a pain medication in it. They can apply this. It's not a narcotic. The patient gets great relief. They're not drowsy. They can function. So yes, the quality of life in patients that I work with Mike has been, the effect has been profound.
Should we really believe all of those horrible things that can happen to us as a result of taking prescription medicines, or is that the FDA telling us just to be careful?
There's some things that are more commonly described that are something that can happen to many patients that take it. Your doctor will tell you those, your pharmacist will tell you those. There's always going to be the 1% or the less than 1% chance that this could happen, and so that has to be put on there if they observed it. So it's not something that you have to be deathly afraid of taking it because of this, but it is something you should be aware of because it can happen.
Now, you make creams, lotions, creams I guess is what they'd be called, that are helpful to people who are lacking in testosterone and estrogen, two very important chemicals that can help us to have a happier life.
Well, in men it's called andropause, and most men after the age of 45 or so, their testosterone level will start to drop, and that's where we come in. We can make a medication with testosterone in it.
So you test your testosterone first to see how much you have, and then you amplify it using...
Right, using the testosterone transdermally usually. There's other ways to do it by injection.
Lozengers,
yeah.
which are meltways in the mouth.
Okay. Right. But and then we can do a product that prevents the testosterone from being converted to estrogen. It's not what we want as men. We want, you know, to keep it as testosterone. So that goes like hand in hand with the compounding. So.
There's been documented strong evidence that supports that some of the estrogen therapy, especially with the synthetics, can lead to breast cancer, ovarian cancer, a lot of bad problems for women. Not something that they want to do just to try to feel better. And so what we have is the natural hormones. It's the next best thing to what your own body makes. It's from plants. It's derived from plants, so there's no synthetic hormones with that, and so it really gives them what they need as far as the therapy without the increased risk.
So is the first port of call for somebody who's concerned either about their testosterone levels or their estrogen levels to go and see their physician?
Correct.
That's the first step.
First step.
Okay.
Number one.
And then once the physician has made a determination as to whether or not the levels are out of balance, they can call you, the physician can call you, and you know how to make the prescription.
Correct. We make them in all different strengths. We make it in all different variations. For some women, we put the estrogen into a capsule, or the progesterone is another one that they also use.
Women make basically 3 hormones: estrogens, progesterones, and testosterone. We can combine all 3 into the same cream.
And dare I say that these compounds are not available at the McPharmacies.
They are not. No, this is definitely...
May it always be that way.
Yes, it's definitely a good thing for us to do.
Yeah. Are antibiotics overprescribed, do you think, in our society?
A lot of times the antibiotics are necessary for ear infections or all different kinds of infections that are bacterial, but if it's viral, it's not going to do anything for that. And I think that's been something that's been out in the news and out in the literature that people are starting to finally kind of grasp and understand. But I think that a lot of times doctors have been giving people what they wanted.
And what about probiotics, Mike? Are you a believer in probiotics?
I am, because it's, the probiotics replace your normal flora.
Mike, final question.
Okay.
Who's your customer? Who do you want to see coming through the door of North Beaches Pharmacy?
I want to see the whole family coming through the door. I want mom and dad. We're going to take care of them. We'll take care of their kids, and we'll take care of their pets.
Tell your doctor that you want to come to North Beaches Pharmacy. Thanks for being with us, and we'll see you again the next time.